Love.
Thank you. Welcome everyone to this webinar today, and it marks the 1 year since the Transformation of Public Health Nursing project began. So you may recall that one of the transformation's key objectives is to embed the iThrive model as a conceptual framework in which service delivery can be organised. We've worked closely with the iThrive Academy, who launched this model last autumn and have since trained Thrive champions within public health nursing. Our aim is to ensure that we align service delivery across BNSSG to be evidence-based and a focus on prevention, early intervention, and reducing inequalities. Some of our key achievements to note today over the past year include establishing the 5 dedicated work streams to manage the different elements of the transformation. We've continued to have a well-attended multi-agency steering group that oversees the progress and takes key decisions. And there is BNSSG-wide representation and includes key partners such as parent carers, commissioners, Bernardo's, health and education. We have gone through 3 reorganisation consultations and are launching the 4th in the next few weeks, which has meant that 0 to 19 public health nursing is now organised into 6 localities that aligns with the ICP and the adult services infrastructure, allowing for the place-based service delivery and activity and better partnership in local communities. We've rolled out the maternal early childhood sustained home visiting training and programme in Bristol, North Somerset, meaning we now have a BNSSG-wide offer for families at risk of poor outcomes. And lastly, the numerous pathways have been designed or are being written, and you will get more information on this later in the webinar. So some key achievements include closer working with the midwifery colleagues to design an effective pathway between them and health visiting with improved communication and processes. And this is in response to serious case reviews and national legislation. The procurement of our new website, which is currently being designed, and there is dedicated groups working on this for the whole of Sirona Children's Services, and we will engage children, young people and families with this work. We're also working with service user groups and Bernardo's as part of our communication and engagement workstream so that we achieve effective and meaningful engagement, and it's built into the pathway design and other developments at every level.
Lorraine, can I interrupt because we can't see the slides anymore?
Oh. Thank you. Nikki will put them on, but it's still all relevant. I'll keep going and we're almost done with my slides. Thank you for sharing.
Let me start again.
There is still a great deal of work to work through, but we're excited to share more details about this work so far. And I will hand you over to Nikki Lawrence, our Head of Public Health Nursing. We'll take you through the rest of the slide deck.
Can you see that now?
Yeah.
Great. So everyone can see it, it's moving. Sorry, I didn't realise that had stopped. So
Nikki, just make sure your cursor is over your screen.
Yes, it is.
Yeah, otherwise, there we go.
It'll move forward. Yeah, we had that before. Right, thanks, Lo. Thanks for that introduction. So I'm going to now go through some more slides, and there'll be an opportunity for questions at the end. But do let me know if it's not going as it should be. Technology. So just to recap on our ambition. So we really wanted to align South Gloucestershire, Bristol and North Somerset as the contract was taken over by Sirona all the years ago, it feels like. And the North Somerset tender provided us with an opportunity, as you will recall, to carry out a service review to highlight good practice, and which there was a great deal of, but also highlight where there are gaps and differences in working, and then to come up with a vision within the service review. We also wanted to embed the national changes to the Healthy Child programme, which really had a greater focus on prevention, early intervention and reducing inequalities. We wanted also to align our services with our integrated care partnerships, of which Lorraine mentioned we have 6. We wanted also to align with our adult services so that we can provide a truly family approach. So by embedding the iThrive model, it gives us the basis on which to develop and provide our vision and organise our services in a kind of logical way. So the iThrive principles really do sit at the heart of what we want to achieve. So these are the 8 principles. You'll see that they're all, I won't read them out, but they're all really quite obvious things you'd think, but they're also things that are really important for families. And we know that if we can tailor make the support we give to families and the level and intensity in which we deliver support by embedding these principles. So we've had training, as was mentioned, from the iThrive Academy. We've got iThrive leads in every area, and we've also had the launch event last year. And what we've got to remember with Thrive is it started off as a mental health conceptual framework, and what we're using it now for is public health. So we're adapting it and we're learning as we go, but we are working closely with the Thrive Academy at the Tavistock, and we've also had great conversation with Manchester, who have delivered this Thrive framework across all their services, and they were really helpful in letting us know where the pitfalls were, what worked well, and any ideas they had. So that was really useful. So what are the headlines over the last year? So we've launched our Thrive and Team Transformation Days. So now I can't see this because I'm going to have to move this. Oh no, I've lost it now. Sorry. Something keeps coming up on my screen. Sorry, apologies. I'm going to try and get back to that now. I'm going to stop sharing and reshare. It's a real problem. Share. Can you see that again now?
Not
Can
yet.
everyone's not yet? So I'm going to have to get off that. I'm going to have to. It's just decided to crash on me. So I'm going to reshare back into it from current slide. Can you see that now?
Yeah.
Great. So I think I've worked out where we got to. So we've talked about the iThrive launch. We've had a number of transformation away days. We called them Thriving Together. Every locality offered this to their staff, and people could move into different ones and attend any one they wanted to. So our staff attended these with an opportunity to ask questions and be involved. And these were successful with good feedback. And we've taken on board every bit of feedback we've had and embedded it in our future work. We will show you shortly just an example of one of the pathways, but you'll see they're quite complicated, but we have written at least 15 of our pathways now, and we're working on many others. And Penny Hazelwood, our professional lead, has really been at the forefront of pulling these together. So it's a huge piece of work. We've agreed shared outcomes framework across BNSSG with our local commissioners. This is a massive achievement, because in the past, all our local authorities had different outcomes frameworks. And when we all looked at them together, we recognised that some of them weren't even relevant. Other ones were not information that we could share. So what we were able to do was come up with an outcome framework that would evidence our contractual requirements, our KPIs, etc. And I'm pleased to say we've now had approval to recruit a BI specialist to work just within public health nursing for the next year, and they'll be able to create those templates, that data stack that we need to evidence our performance. So that's really good piece of news that's very recent. We're now entering our stage 4 reorganisation. We've reorganised our senior management and management levels, and we're now on everyone else. This has taken a lot longer than we thought, because we've had to rewrite or refresh 16 job descriptions. So we've worked closely with staff to do this, and these are now sitting waiting for banding, and the official phase 4 will launch soon as the banding has been completed, which hopefully will be at the end of April, barring any issues like coming out at the wrong band, etc. So that's ongoing, and that will mean that we're all working to the same job descriptions, and that we're going to be sitting in the locality models, all of us in our entirety. So we've had really positive engagement work on our website, working with parent carers, with Bernardos who sit in our groups. And we're also going out to other areas where we have service users, such as baby hubs. Our family nurse partnership team will engage their service users to review different parts of the programme that we need feedback on, and different parts, maybe our pathways, etc., letters. So that work is ongoing, and we're lucky to have an NHS graduate, Hannah, working with us on some of these things. And also the rollout of MESH and the iThrive module. This is huge. Lorraine mentioned MESH, which is something that's already delivered in South Gloucestershire. So it's for any family with at risk of poor outcomes. So they will get an intensive health visiting offer. And we're pleased to say that we're about to launch Train the Trainers, and we will then be have experts within our service that can train staff that haven't had that training yet. We're already recruiting across Bristol and North Somerset, where these are the new areas where they've just received training, and we're being well supported by South Gloucestershire, who have been doing Thrive for quite a long time. The iThrive modules have also been well attended, and we've actually recently done the management modules within that. So that's kind of public health nursing headlines update, but we'll give you a bit more information as we go. This is our infrastructure diagram, which you've seen before, but I just wanted to highlight that public health nursing transformation steering group is a multi-agency, multi-partnership group, and every decision made is taken through that group, that's filtered up and down from our other 5 work streams. That multi-agency steering group is really key for us, and it's well attended from across BNSSG and across many different disciplines. We've also got leads in every single one of these 5 work streams. So within our monitoring and evaluation, our chair is Jo Pratt, who's one of our operational leads. Within our comms and engagement work stream, we have Wendy Best as chair. I'm chair of the Pathway Design Group, but to be honest, Amy, our project lead, tends to be more organising in that. Our workforce and training group is chaired by Karen Glee from our training department, and our enablers group is chaired by Linda Franklin, our head of finance. So, you know, we have really good engagement internally across Sirona, so that every single area of our organisation is involved with this transformation. And we've also got external partnership engagement. So we really feel this is a strength. So all the different chairs and all the different groups have sent in just one slide each to say what they're doing now, what they've achieved, what their current priorities are, and what their future ones. So I'll just go through those. I won't read them all out, but our monitoring and evaluation group has been doing some really amazing work around the friends and family test, around getting case study templates done, and also, as I mentioned, pulling together that shared outcomes framework. Their current priorities are all around the friends and family test, and they're working really hard on that and going to start pilot. They're going to look at how audits are really important for us about evidencing impact. So they're going to look at our pathways and make sure they're completed to establish how they will be audited. So audits are built into every pathway as appropriate. And they also going to work out the best way to set up audits on Ulysses, because we have had a few issues. So we're really working closely with to try and develop this. So future priorities, we're going to assess the audit requirements of new pathways as we go, and we are doing audits. So we're testing them each one, and as we roll out pathways. We're reviewing that friends and family test, and making sure we have the right input and templates with EMIS. So we really, our next big piece of work is to rewrite or to coordinate all the EMIS templates. So we're reporting what we need to report, and we're pulling out the information we need to pull out. So the scoping work has already started, and we're going to be launching it properly across the summer. So the EMIS team have been working closely with us. So I think that's really positive and will make a big difference for us that we're all using the same templates. So the next one are our communication and engagement group. So they've procured a website develop company, and their concepts have been created and tested with different stakeholders. That's a massive piece of work. I mean, that one sentence just doesn't sum it up. And I know Wendy Bess has got grey hairs over this now, but it's a huge piece of work. And it's not just for public health nursing, it's for the whole of children's services. We've got a number of letters, different letters across areas. So parent carer groups are really looking at these for us and deciding the best ones. But we're also going to test them with a wide range of parent carers across in our baby hubs, and maybe with our family nurse partnership clients and some mesh clients, just so we can understand which ones read best, how they like the format. So getting some really good quality feedback so we can co-design these. So we're also looking at our duty lines. So these are the mainly health visitor lines that families can bring up, and it's their interface when they've got queries and want to sort out appointments. So we're looking at which model, because they're all different across BNSSG, which model families prefer, so we can embed that. So current priorities is supporting other work streams in relation to their comms engagement. That's actually a really big job. So making sure we get the comms and engagement embedded in every single pathway, work stream, etc., as we need. So the CCH branding is currently being looked at and updated as necessary, and also designing a new website. And they want to make sure the website's secure. That's a really important piece of work, working with IT, etc., to make sure that happens. So future priorities is the website. Again, a big, really important part of it, our transformation. To have a social media group, I know many of you will be really happy about that, because we get lots of queries about, can we share this on social media? So it will be really good to get that right. And also have a pathway to design letters, as I've already mentioned, with our stakeholders. So our group, the group that I chair, is a pathway design group, and we meet every single week, barring holidays or people being absent. So we've now looked at 15 out of 38 pathway drafts and final versions. So they've been signed off, the 15, by the steering group. So that, I think that's massive. And you'll see on the next slide a pathway, which I'll get Penny to talk to. We've got 11 quality checklists. These are the checklists we need to make sure that we've ticked off all the areas for each pathway. So 11 have been done so far, and we're going to be working through them as we design the pathways. And this is something that monitoring and evaluation work stream have created and passed on to us, and they're checking. So you can see how closely aligned all the different work streams are. We've got 13 EMIS processes now developed, and as the scoping goes ahead, and 10 have been signed off. So that's really positive. So we want to agree our first pathways to go live. Some of that will be dependent on us getting our admin sorted out properly. So I'll talk about that shortly, but reviewing our admin processes on the back of the last year's review is really key for us. Development of our webinar review process. We've been asked to make sure that all our webinars are quality assured. We've got a really great series of webinars, both live and recorded. So we're just going through a process of quality checking these. And we're really focusing at the moment on school nursing core pathways, and which will include their referral processes and clinics, to make sure that we align this across all areas and we have one single offer. So what are our future priorities? So it is rolling out the first pathways and getting that right. It's getting this EMIS work correct, getting the templates right. We've got a working group on that are currently looking at this, and having a real focus on our school nursing high impact pathways, because we stalled a bit on those and we're now going forward with it. And Penny Hazel was leading on that. Penny, I wonder if I can just bring you in to just talk to this. I'm not expecting you to go through it in any detail, but just really to talk about the process of pulling the pathways together.
Yeah, so this is one of the pathways, and if you haven't seen it before, I can see it would look really busy, and it's probably too small for you to look at the detail, but this is what they all look like. They're all the same layout, so once you get used to it, they're all the same layout, and you can see that it's using the based on the I Thrive needs groupings. And there is if you look at the band on the left-hand side, there's a theme of SEND and safeguarding and emotional well-being that runs throughout all the pathways. So that's a theme throughout rather than something separate. The plan is that all the pathways link together. So you can see that some of the buttons are color-coded as well. So the plan is that they link together. This is all the pathways are designed around the high impact areas, so you can look at all those on the website. So there's 6 for health visiting, 6 for school nursing. There's also 6 for maternity. So this one is part of the improving health literacy and managing minor illness and reducing accidents. And it's within that, it's the pathway around managing ED notifications. So this is, as I say, that's just one example of a pathway, and all the pathways will be on Workplace eventually. So everybody will have access to them, and everybody will be able to go into Workplace and hopefully quite easily find the pathways so that they're easily referred to, so that you can refer to them every day as we go through our day. There's a really robust process around developing a pathway. So depending on what the pathway is, it depends on who's involved. So there's lots of different people involved in different pathways, and there's various different working groups and task and finish groups for each pathway. It often involves practitioners, but not just practitioners. Often admin staff are involved, or BI staff, operational lead. So making sure that we include every aspect of a pathway, not just the kind of clinical side. So the process does include things like a quality checklist. It includes things like service user feedback. It includes identifying training needs. It includes making sure things don't go round in a loop forever. So we need to make sure that it flows from beginning to end. So there's lots of things to look at in a pathway, and there's lots of people looking at it. It does go through a process. So the work streams that Nikki showed you previously, the pathways go through those work streams, and then eventually they go up to the transformation steering group and get signed off, and they go via that group twice, because often there's feedback and then it's all looked at again, and then it goes back up to the group. So I think that's everything to say about the pathways. So if you haven't seen one before, that's what they're going to be looking like. Do you want to move on to the next slide? So this slide shows, it's a list of pathways, and because obviously, as Nikki says, there's 38 at the moment, so we need to be able to keep track of where we are. And often there's several different pathways being developed at the same time at different stages. So we need to have just some kind of way of keeping track of where we are and which ones have been signed off. And sometimes we can have developed a pathway, then we're developing another pathway, and then we think, well, actually, we need to change the previous pathway again so that it all links together, because we need to make sure they all link together and we're not saying different things in different pathways. So IM is really good at keeping that up to date. And you can see down the left-hand side is the list of high impact areas. So you can see, for example, transition to parenthood, high impact area pathway. There's actually 6 pathways, separate pathways, that are under the heading of transition to parenthood. And obviously there are some core pathways that run across the whole of the 2 services. So I think we can go on to the next slide. And then as the pathways are developed,
sorry, excuse me, Penny, but the slides aren't moving.
Okay.
Oh, why has that happened again? So I just try again?
Which slide are you on, Hallie?
They are for me. I'm wondering if are they not for anyone else? Because they are for me.
Yeah, mine's working.
It might be you, Ali.
We're on the EMIS processes.
Yeah, that's the right one.
Yeah,
that's
just
the right
come
one.
in now.
Sorry.
Oh, is it? Okay. So so as the pathways are signed off, they are then shared with the EMIS processing mapping team. So this is led by someone who's very experienced, and then there's also practitioners involved in that as well. So and there's a lot of communication between the pathway design group and the EMIS mapping process. So we're working very much in tandem, making sure that the pathways are then represented correctly in the EMIS process mapping. So there's a whole log of where we're up to with those as well. So I think that's everything I was going to talk about.
Penny. Thanks, Penny. That's really helpful. I can't see anyone, so we can take some questions at the end when I take it down.
I think Denise has got a hand up. Denise, have you got your hand up?
I do. Is that all right?
Yeah, sure. I just can't see anyone.
Penny, thank you. The pathway slide, hats off to whoever pulled that together. That looks like the devil's own work to get that onto one slide. So congrats whoever did that. The bit that I'm curious about, Penny, well, there's two bits for me, is the interdependency or the handoffs between organisations. Is there any support that we need to offer in to kind of make sure that that dovetails nicely? And then the second question was around the transformation steering group. Is that Sirona's transformation steering group, or?
Yeah.
Well, you can answer the first one, Penny, and I'll answer the steering group.
Okay. So when I say various different people have been involved in the different pathways, that does include sometimes different other organisations. So a good example, Denise, is some of the ones that have been included involving midwifery, maternity colleagues. So, for example, there's a pathway around health visitor midwife liaison, and so that was done very much jointly with our midwifery colleagues, and they are also members of the transformation steering group and also of the pathway design group. So, and there's also another pathway with NICU staff in MBT and UHBW. So where the pathways really do overlap with other partner organisations, we have written the pathways jointly. So does that answer your question?
Yeah, and then I suppose that's exactly what I kind of would have imagined was happened, but it's just if there was any support that was needed, if there were any barriers to that, but you can have a think about that.
So I've logged that, Denise, so your offer of support if we come across
thank you.
And then
the other bit for me, and this is probably in relation to that whole list of pathway work that you've got there. You gave one pictorial example, but there's obviously others that you're working on. I suppose, Lorraine, it's probably more that something that we need to think about is kind of currently what we're trying to do is take pathway changes through that healthcare professional executive leadership group, which is a system group. Now you're working on, I don't know how many is on that list, but it's quite a lot. And whether or not we want to take in a bit of a highlight slide, Lorraine, into that group to kind of talk through what's happening in this world, so that there's that kind of system awareness. I can't see Lorraine. Is she still on the call?
I don't know, because she was at Engineer's House, so I know she had some issues. But what I could say is we do have highlight slides we've created, so you don't get you get a summary of the pathways, and we're more than happy to share those. But I mean our steering group, it's run through Sirona, but we have multi-agency attendees across BNSSG, from education, health, from all sorts of different groups.
I'm not doubting that.
Wondering if
Nikki, I'm not doubting that. It's just that we
to whatever group.
Yeah, it's just whether or not we need to take it through that route. So I think that's something for us to just, I probably need to go away and reflect on it and possibly speak to yourself and Lorraine about whether or not do we need to, but if we were going to, how would we present it? Because it's a hell of a lot of work, isn't it? And it's how do we present it concisely so that there's the kind of opportunity for the clinical exec to kind of understand and critique.
Denise, we've already got some. We were asked by our steering group to simplify them, so we do have some we could share with you that you could see if that was the sort of thing. But they really just on one page, and it just says what they are. It's very simple, so we could Amy could share some with you.
Perhaps we pick it up
outside.
I'm conscious everybody else is listening to a conversation that they probably have no interest in.
Yeah, of course. Right, I'll just then go on to our workforce and training group. So obviously one of our key key achievements within that is to get everyone trained in mesh, everyone that we can so far, and to get that in place. So that's been really positive, alongside the iThrive rollout and training of our champions. We've got Anton now as our dedicated children's business partner, and I mean, I contact him so much. He's going to have me up on bullying or something soon, because I'm constantly on to Anton, but he's been brilliant, very supportive and very involved with the transformation. So he's got a really good overview, and supported by his team as well. Our current priorities are completing our consultation, so launching phase 4 for the remaining staff. To develop our workforce strategy, that's a really important thing for workforce and training, and Anton's leading on this, and we're going to look at all different elements such as recruitment, retention, training, as it says there. And we really want staff to see their future, to see that they can train, they can develop. So that's going to be embedded within our service, public health nursing service. So we're going to bring in new apprenticeships, we're going to look at different opportunities, management training, we're going to introduce senior nursery nurses, so people have got somewhere to go with that, etc. So this is ongoing work within workforce and training, also within the whole of public health nursing, looking at what development looks like. And we know that staff tend to stay longer in organisations where they feel they can develop and are valued. So our future priorities within workforce and training is to complete that consultation, to develop that workforce strategy, and to extend iThrive. And we're looking at the Thrive conceptual model as a model for across Sirona. And I'm involved in the engagement work that's going on across Sirona, and we've embedded the Thrive model within that. So hopefully that we'll have trainers that are trained up that can deliver any training within Sirona as well, for other teams that might want to embark on that journey as well and embed that model. And then finally, our enablers group have had workshops on their estate, so for public health nursing, and I know our operational lead Lee has been really involved in that, and Clive Coombs as well. We've reviewed all our estate requirements for baby hubs. So this is really important, because we need to deliver our baby hubs in areas where families can get to them, that we're offering place-based support, etc. So that work's been carried out. And we're looking at options for text messaging, because we know that families often respond better to text if we can confirm appointments, etc. So that's been looked at. So at the moment, one of the priorities is to carry on with this survey of the duty line. And so we've got a model that we can build into our pathways of what it looks like across BNSSG. So we have got issues with estates. Our North Somerset colleagues will say, yep. So some of our estates are not in good order in North Somerset. So they're looking at the moment at the different options, particularly to have a satellite base in Woodspring as well. So that's currently being looked at by estate. And ensuring staff have the right kit for the work they need. And that we've been very successful. We've managed to get the phones and laptops. So things have improved greatly on that front, and that work's ongoing. So the future priorities is that duty line survey I mentioned, support to other work streams in relation to all these issues, including finance. And we're currently working on a demand and capacity tool, which is almost finished, that this enablers group have been involved in, and we'll be looking at using that to show, have we got the right staffing within the area, etc. So this is, I'm not expecting you to look at this or to do anything, but these are our strategic priorities. I just thought we wanted to show you that, I mean, Imi, I don't know if you wanted to talk to this a minute, Imi, because I don't think I can possibly pull it apart, really.
Yeah, yeah. Thanks, Nikki. So this is not unique to public health nursing. This is what every programme in Sirona has to submit to the Transformation Directorate and report to the ICB. It is the priorities, but it's also a very high level version of what our timeline is. If you imagine our timeline is it's very, very long, and this is a nice high-level summary. So probably each one of those blocks actually represents about 20 actions. So just to give you an understanding of how big this is, it's RAG rated, so anything blue is already complete, anything green's on track, amber off track but manageable, and then red is off track and being addressed. So as you can see, it's split into, we've got the steering group at the top, which doesn't have loads of priorities identified just within that, because it's all covered across the work streams, and then they are underneath that. So again, like Nikki said, we don't expect you to be able to see the details, just to show what we submit and how we keep track of it. Also, just to say, this moves. So if we share the slide up, please don't take this. It moves depending on what the priorities are. Things will change, the dates will change. If it's a big change, it'll go through a change process, and we'll seek permission from the steering group to adjust that. One of the groups that probably changes the most, if you see, is the second to last one, the pathway design group. When we're developing the pathways, you can see there's a nice big clump of the pathways now that we're saying are all green. That's because we identified lots and lots of core pathways that applied to everything. They weren't identified under one high impact area, but that was kind of the bulk of the work. And obviously, as time goes on, the pathways get quicker and quicker, and we get more familiar with the process, and also people that we're asking to help inform us. They get familiar with the process well, so they know when we knock on their door, they know what's coming, what we're going to ask, and that development process is getting much quicker. We're also in line with the EMIS process mapping side of it, so we want to now get all the first drafts of the pathways to a really good point where we can start that process mapping and start implementing those changes and looking at the training. The red ones are linked with our BI request, but we've gone out, or we're going out to recruitment now for a BI analyst. So you can see the red ones there. We'll be reluctant to change them until that person's in post, but that has been addressed just to identify that if people see the red ones there. But yeah.
Thanks, Amy. That makes a lot more sense. I was just going to, before finishing having questions, this is just our pathway. I'm not going to go into this in any detail because you've seen a lot of this. I think it's important to mention that we haven't forgotten admin. Admin is really important. We want to make sure that we've got a robust organisation, or we organise our admin in a robust way across BNSSG, that there's appropriate support for admin, that there's a development programme for our admin staff, etc. So we are working on that, and there will be shared job descriptions, etc., that we're going to be working on, and that will be our next consultation, will be around admin, but after phase 4. But as you can see, there's a lot of work going on, and I'm not going to go into that. I'll take this down now. There's just a couple of quotes at the end, but I know we've got Kent on here who could talk about the transformation from the point of view of parent cares, because his organisation team have been very, very supportive. I'm just going to go off this now, just so I can see people and take it down. Let's just hope I can take it down now. There we go. So that is our 1 year, summary, really. I'm sure there's loads of things we've forgotten, but we didn't want to drown you in it. So I don't know if there's any question, or Kenton, if you want to say anything.
I can just say a quick couple of words, but as parent carer for North Somerset, we work closely with parent care forums in South Gloss and Bristol as well, and I've been sitting on the steering group on behalf of all parent carers across BNSSG. It's been very positive in terms of keeping that focus on early identification, the pathways, and thinking really how does it affect the service users, those that these services are designed for, and actually making sure that is at the heart of everything that's going into this, that we're bringing that voice of the user and who we're doing these or making these services for really at the heart, and asking ourselves actually how will this affect those that we're trying to support, trying to ensure are getting the services and their needs met in the community. So that's very quick, but it's been very positive being involved and making sure that's at the heart of all these changes. Thank you.
Thanks, Kenton. Much appreciated, and your support's been very much appreciated. So thank you. Didn't know if there are any questions. We've got a few minutes, or any comments from anyone.
I think there's some in the chat, Nikki.
Ah, right. I haven't been monitoring the chat. I think Charlie, you've got your hand up.
I was just going to say, really impressive work, well done. And that was a really helpful update. It'd be really good to share that with some key people who weren't able to be here today. Are we able to see the slides and share them? Yeah, brilliant.
Yeah, absolutely.
Slides, brilliant. Okay.
Yeah, we'll share that out.
Fantastic. Thank you.
Go into the chat and see what I've missed. Wow. Oh, there's some nice ones. Thanks, Gary. Julie's question about health visitor advice lines. I don't know what we're going to call them, Julie. I think we just said we've put duty lines because some areas call them duty lines, but I think that's part of the decision making. What are we're going to call them? Advice lines? I don't know. I think that's all part of the work. I think that's just what we put it down there. Suzanne, do you wanna? I'm just trying to search through these. Do you want to come in?
Yeah, I've been trying to search on the Thrive website to find out how other places have been able to implement Thrive in health visiting specifically, and
Nowhere
I
else
can't find anything.
Nowhere else has. That's why you can't find it. Yep, we're leading the way in public health nursing. In when we spoke to Manchester, they have done it in other services, but they've done it very much from a mental health point of view, from a CAMS. That's what they said, didn't it, Penny? You were at that meeting.
Yeah, they've implemented it across a whole area, you know, kind of like an ICB. So not as detailed and specific as, say, public health nursing. So we are the first public health nursing team to roll out iThrive, and actually they've been really helpful. I mean, it was a bit tricky at first, wasn't it, because a lot of the training modules were very focused on school-age children and mental health, but now they really understand where we're coming from and what we need, and they're being really helpful. So what's happening? I've noticed there was another question there about iThrive and the training. So the iThrive team have delivered one set of each of the modules that different people attended, and there's a few trainers who've been trained and who attended the training, and the next step is for the iThrive team to sign off those people who've been identified as trainers, and then we can start rolling out the iThrive modules in-house. So there's a bit of a gap at the moment between the iThrive team delivering the modules and us getting ourselves organised and ready to do the training in-house. And it's not quite as simple as, say, MESH, because with MESH you get the training, you train the trainers and they deliver the training. Because we're the first public health nursing team to be rolling out iThrive, there's a bit of tweaking and changing to do to the modules to make them relevant and appropriate and helpful. So there is going to be a little bit of a gap, but hopefully once we get going with the training, we can then roll it out quite quickly and we can get some real momentum about it. But there is this gap at the moment, unfortunately, which is why we haven't sort of been talking about training at the moment.
Thanks, Penny. I did notice a comment about BI and linking with local authorities. And that would be our ambition, that we linked our BI analysts, dedicated BI analysts to our local authority areas, so that we can really get that, make sure that we're capturing the data we need to be capturing. And similarly with our midwifery colleagues, really getting that information sharing and data sharing correct as well. I think I captured most of the ones in the chat, unless there's something I've missed. Has anyone got any more questions or comments before we finish? I can see any. No, so this will be recorded for colleagues that haven't been able to attend. But really, it's been, as you can tell, it's been a huge journey. There's a lot of work going on. I didn't mention also that Penny Hazelwood has pulled together some workshops every month for our Band 7 clinical leads and for our locality leads. But our clinical leads, we really want to give everyone a voice and so that they're really involved in this transformation, that they've got a big say, and that that's filtered down to teams. So we're trying to get that bit right, but I do think the workshops have been positively evaluated, and people seem to value them. So we will continue in some form or another working with our groups to make sure that we're a big service. We've got almost 500 staff, so we really want everyone involved, but it is a challenge. So etc. I think, Russell, you said something there about existing submissions. So yeah, Russell is all things contract and business, so I'll make sure that any data stuff goes via that group as well. Don't worry, Russell. But if there's no other questions, just thanks for your time, and thanks for everyone for your engagement in this. We've had really good engagement from our partners and from our internal staff, so and all our departments in Sirona. So it's been really, really positive. Will there be care pathway workshops? We will be, the pathways will be rolled out, won't they, Penny, to the different groups, etc., as needed as we roll them out.
Yeah, there'll be training and sessions that's relevant to a particular pathway with the right people. Yeah, but that hasn't been planned yet. We're not there yet.
We will be.
We will be.
We're getting there. So yeah, thanks. So we run over by a few minutes, but thank you. To our next catch up, but if there's any queries in the meantime, just feel free. You can go via IMI or come directly to me and Penny, and we're more than happy to take any questions or any comments. So thanks again for your time. Bye everyone.
Thank you.